Live. Oh my gosh. Today has been kind of a morning, but I'm going to do what I normally say to do, and that is to share this on my personal Facebook page. I'm just going to do that real quick. Get people going here. See if we're live. Looks like we're live. We should be live here on Facebook and YouTube. Is it going to work? I hope there's no problems. Is this going okay? Everybody can see me? Like there's a problem with me sharing it. Hold on, guys. 1 second. I'm going to go grab my puppy because she's whining right now. She was at the vet earlier today. So I will be right back. Hi, Kimberly. Good to see you. I'll be right back. This is not the usual way I start this, by the way. And I've got a whiny puppy situation. Be right back. Here, and sit on the lap. We'll see how we do. See how we do. Oh, hey, this is real life, everyone. Here we go. I've got a puppy here. I am going to have her sit on my lap because I had to take them to the vet this morning for their shots, and it took longer than I thought, and it was the whole thing. So now they're going to be whiny for me, and I'm just going to have to adjust. Here we go. Trying to share this on my personal Facebook page, and it's not letting me pull up. Something's wrong with the Wi-Fi. I hope everyone can hear me okay. Let me try and connect to my house. What's going on? What's happening this morning? I'm usually much more together than this. But you know what? This is real life, isn't it? Here we go. That seems to work better. Hi, baby. Hi, baby. Guys, these puppies are getting so big. It's just crazy. Crazy how big they're getting. Here we go. Let me share this now. Now I can share it, get people joining us. Yes, I can. Well, anyway. I am so happy to be back with all of you today. It is wonderful to be here for our normally scheduled program. Welcome all as people start to log in. Don't forget to share this on your personal Facebook page. That way more people can get connected to community. It is April 7th. Can you even believe it? I cannot believe that it's April 7th. It's National Minority Health Month for April. It's also Sjogren's Awareness Month, which is something we will be talking about in just a few minutes. I have been out of town with my family for a little over a week, and I'm just trying to get back into the swing of things, making up on appointments, you know the drill, playing catch up with life. So this morning was interesting. It's pouring rain here. I got drenched a few times. And had to take my little puppies in to get their puppy shots. And that took longer than expected. And then my son is actually off school today. Today's a teacher work day. So navigating, having him home. My husband's off today. There's loads of laundry, lots of things to catch up on. All really interesting things. But let me just say hello to those of you who may be new, who are streaming this live or may be watching this later. My name is Kelly, and I'm very happy to meet you. I am the creator and executive director of this Portland-based nonprofit, but we do work around the world online and virtually, called More Than Lupus. Hi, Jill, good to see you. And if you're unfamiliar with More Than Lupus, We are a multi-ethnic, multi-generational, and international community, online community of support designed by lupus patients. That's what makes us different. And we designed it to connect and to grow and to inspire each other throughout the peaks, which are the highs, which we celebrate, and the valleys, which are the lows, which we all go through, of our lupus journey. And I say our lupus journey communally because I have lived with systemic lupus and multiple lupus overlap conditions since the age of 11. I was 11 when my symptoms came out. I had a bleeding disorder as a child, and then I contracted somehow Epstein-Barr virus. And with my ethnicity, I am Mexican American, and also with my family's propensity to rheumatic illness, it was just a perfect storm. So, 11 years old, I had severe joint pain and fatigue and sun sensitivity and headaches and brain fog and weird blood work that led me to be hospitalized at Children's Hospital Orange County for 6 weeks. And then after that, my entire middle school / high school years were in and out of children's hospitals, had surgeries, had many rounds of intense immunosuppressive therapy. Then trying to have a baby was a whole thing. So yeah, it's been a lot of peaks and valleys. I navigated this illness for now 33 years. So I'm not a lupus expert still, wouldn't say that. But I have learned the things that kind of have held me back. And I've learned the things that have really helped me. And I hope to, with this platform, make a space for all people to feel that wherever you're at in your lupus journey, if you're newly diagnosed or you're a lupus veteran, no matter your background, that you are treated with equity, with dignity, that you're taken seriously. I know many people aren't. And that's our mission here at More Than Lupus, that people feel heard, that they feel seen, that they feel valued. And this is especially important if you are newly diagnosed with lupus and you're just finding us, because we see you. We know how overwhelming this can be. And if this is you, we highly recommend that you check out our blogs at morethanlupus.com. We have many different blogs, everything from lifestyle to spirituality, to medications, to diagnostics, to mental health, all of it. Because navigating this illness can be tricky. There's no denying that. It is very complicated, and we don't want you to think that you're alone in it. We really are not wanting anyone to feel that they are fighting this alone. We are wired for community. We are wired for connection. And this is one way that we've designed this platform so that you can feel safe in this space. First, I also want to let you know that due to various reasons, our monthly in-person support group is temporarily on hold, but we are meeting virtually. We hope to gather for a big event in May. More details on that soon. We will still be having our virtual support group that usually meets the third Saturday of the month. Last month we pushed it back, I know, 1 week because of my son's Taekwondo tournament. But this month it will be the third Saturday of the month, which is April 19th. That is not this Saturday, but next Saturday. And it'll be at 3 p.m. normal time. So that is West Coast time. So that's 6 p.m. Eastern time. If that is what works for you, please join us. We've got people from both coasts that come on and connect with us. And it's a lovely time of just sharing and troubleshooting and giving space to people to kind of talk about what's going on in their life, where they don't feel that they have to wear a mask or pretend that everything is okay. Also, we have our Getting to the Heart of the Matter lupus heart health virtual event and our kidney nephritis virtual educational event. Both featured Dr. Don Thomas, who wrote the Lupus Encyclopedia, are up on YouTube. These were highly attended events. They were really, the engagement was fantastic. Um, he was so informative and he gave so many pearls of life-saving wisdom when it comes to improving your cardiovascular health and improving your kidney health. He gave us hope, didn't he, when he said that not only can we prevent lupus nephritis, we can prevent flares, we can help shorten them by being proactive instead of reactive. And it was really encouraging to hear that. Also, if you want to continue to hear these types of educational events and want to be privy to the resources that we provide, would you please consider giving towards us? This has been a really hard financial start to the new year with grants being pulled and our little funding that we do receive stopping because of funding being cut. So any dollar makes a difference. We are really, really trying on every way to save costs. But we can't do it alone. I can't do it alone. So even $5 today, and I'm going to go ahead and put our donate here. And if you can, it would mean the world to us. As I mentioned, every dollar makes a difference. It truly, truly does. All right, let me go ahead and give the disclaimer. And then I'm going to get into today's topic. We're talking about Sjogren's syndrome today. And even saying the word makes my mouth dry. Do you feel like that? Oh my gosh. Oh, what are your thoughts, my love? What are your thoughts? You're such a sweetie, aren't you? This is Frankie right here, by the way. Frankie had shots today. So let me go ahead, get a sip of water, do the disclaimer, and get into today's topic. And in the meantime, please post any comments, questions, and concerns. What I do is I do the topic, then I'll give you a little inspiration. You're right. It is Sjogren's. Did I say syndrome? It is Sjogren's disease. You are absolutely correct, Cheryl. That's a bad habit. They recently updated the diagnostics, so now they are referring to it as Sjogren's disease. But it is, I've had it for a very long time when they used to call it Sjogren's syndrome, so my apologies for that. In the meantime, any comments, questions, concerns? Maybe this is your first time here and you want to know more about the resources we provide. Maybe you're going to a rheumatologist appointment and you're confused about what to say, what to bring. Maybe you're having a hard time kind of presenting your lupus to your friends and family, and they're just stonewalling you or dismissing you, not taking your lupus seriously. Maybe you're thinking about starting a new biologic like Benlysta. You've heard about Saphnelo. Is one better than the other? Has anybody taken those? Maybe you have a new symptom that you just want to talk about. All those things, put them here. And once I get through today's topic, I'm going to give you a little inspiration as well. I will start at the top and I will work my way down. My goal is to get through everything that's here. Leave no comment unnoticed. Okay, that is the goal. So here is today's disclaimer for our Monday Lupus Live Facebook support chat. Our Monday Facebook Live support chats are aimed to be a positive and open space where we can both give and receive support and encouragement from others. I am not a doctor. I'm not Kelly MD. I call myself a researcher by proxy, but that's about as good as it gets. I do pull from great medical resources that are vetted and appropriate, but I cannot give you medical advice or diagnose the symptoms that you are having. I can't even tell you that what has helped me in my 33 years of living with lupus will help you, because we're each very different. All that we can do at More Than Lupus is provide you with information that hopefully you can, in turn, take back to your doctors and have an open and honest conversation about what may be the right path for you in your medical plan. Additionally, this group is intended for those living with lupus or lupus overlap illness. It's also intended to provide support and encouragement to those who know someone living with lupus, a friend, a family member, a coworker, a loved one, a neighbor, a significant other. But if you don't fall into those two categories, this is not the right chat for you. Sometimes this chat gets shared for whatever reason in places, particularly on YouTube. I'm finding that it should not be shared, and you will occasionally see spam here. I see it on my end. I can get rid of it on my end, and then I will tell you to refresh your page. And that is all that you need to do. Do not spend any morsel of your precious energy on engaging in something that you know shouldn't be there. Don't engage, refresh your page. That's my motto. I'm sticking to it. Also, once again, I want to remind everyone to share this. The more you care, the more you share, the more other people are aware, right? It amazes me after 8 years that people come up to me like, it's the first time I'm finding you. And it is wonderful to know that we're still getting spread by you all. Thank you very much. And people are getting connected to community and support. So let me get straight into today's topic. And I think I have a banner ready as well. I saw it up here. Where'd it go? I just saw it. Maybe I did not do it. Well, that's okay, because I can do it right now. No, it was the Raynaud's one I saw. That's what it was. Okay, I know there's a little double dot over Sjogren's, but I can't do it on this end, so I apologize for that. So yes. Oh, what are your thoughts on that? What are your thoughts on that? Okay, so with April being, and by the way, it is pronounced Sjogren's, like show your grin. Show your grin, Sjogren's. And now it's disease. It used to be syndrome, but it's disease. So I apologize if I say syndrome, the bad habit to break. April is Sjogren's Disease Awareness Month. And we thought it would be a great time to just go back and spotlight this often common lupus overlap condition and just talk about some things that people should be aware of who may have been diagnosed with secondary Sjogren's disease or maybe suspect that they might or wondering what the symptoms are. So yes, it is pronounced Sjogren's. It's an autoimmune disease that primarily affects women over the age of 40. Yes, once again, aren't we lucky? However, don't let that fool you entirely, because Sjogren's disease can impact women and men of all ages, as well as any racial ethnic group. It's seen across the board, however, primarily disproportionately impacts women over the age of 40. Millions of people live with Sjogren's in the United States. It's actually one of the most common autoimmune disorders in America. Did you know that? A lot of people have it, they don't know it. A lot of people think they have it, they don't seek treatment for it. So it could be even more common than we think. In Sjogren's, your immune system, which is your body's natural defense system, attacks the moisture-producing glands in the body, okay? Now, with lupus, your body's natural defense system produces antibodies that attack your healthy cells by mistake. And when that happens, it causes inflammation. And if the inflammation is left untreated, It can cause tissue damage and unfortunately even organ failure, and at its worst, premature mortality. Now, primarily with lupus, it attacks your connective tissue, and that can be everything from your joints to your your heart, to your kidneys, to your lungs, to your brain, and your skin, which is your largest organ. And that can cause a whole host of symptoms and problems. Now, with Sjogren's disease, it attacks your immune system, goes after your moisture producing glands. Why? It is considered to be somewhat of a genetic predisposition. They don't know exactly why, but the process of your immune system attacking your moisture producing glands can cause painfully dry eyes and mouth. It can cause a dry nose. It can also cause dry vaginal dryness as well. It can be dry skin, vaginal dryness, nose, all those things, as I mentioned. And it can also, at its worst, impact the kidneys. It can impact the lungs, the blood vessels, gastrointestinal tract, particularly your esophagus as well, liver, pancreas, and even some people have problems with their central nervous system with Sjogren's disease too. So it can get pretty tricky. It can get pretty tricky. So when Sjogren's occurs by itself, it's classified as primary Sjogren's disease. If Sjogren's occurs when a patient already has been diagnosed with another autoimmune or connective tissue disorder like lupus or rheumatoid arthritis or scleroderma, mixed connective, it is classified as secondary Sjogren's disease. Make sense? Yeah. You can have Sjogren's disease without having other connective tissue disorders. But as we are aware, unfortunately, autoimmune conditions, as I've mentioned here many a time, like to party together. It's like, okay, wait a second. I have one disease. That's enough. That's it. No more. No more. Okay, I'm good, right? And you're at your house, and then your doorbell rings, and you open the door, and it's like, ding dong, rheumatoid arthritis. I don't remember inviting you to my home to this party. And they walk on in, and then you're like, okay, fine. I've got rheumatoid arthritis and lupus. And then ding dong, the doorbell rings, and you go and open it, and you're like, what? Raynaud's syndrome? What the heck? I didn't invite you to my house and to this party. And they walk on in, and you're like, okay, now I have Raynaud's, RA, and SLE. That's great. And then ding dong, once again, the doorbell rings, and you open it up, and it's Sjogren's disease. And you're all, hold the phone here. No room in the home, no room in the inn. Keep on moving, kid. And they come on in, and you're like, oh, great, now I have Sjogren's. It is very common, unfortunately, with these diseases. They like to party together. It can be challenging, though, in a lot of ways, differentiating between them, right? And what's causing what? Is this normal fatigue from everyday busyness, or is this a lupus flare coming on? Or is this caused from Sjogren's or RA, or if you have fibromyalgia or something else like that, right? It is very difficult, particularly with Sjogren's too, because some of those symptoms are very similar to lupus as well. Both lupus and primary Sjogren's disease can cause rashes, can cause skin abnormalities, arthritis, and even at its worst, kidney disease. Both diseases can also cause a positive ANA and suspicious antibodies that are SSA, SSB, all of those. And similar genetic variances can appear in the blood if you have Sjogren's and if you have lupus. So it's really tricky. It's really tricky. And it can be hard for the doctors to get to the bottom of things. Now, if you suspect that you are feeling something's off, maybe you're dealing with thrush a lot, your mouth is always dry, maybe like me, you had really bad bloody noses and still do have bloody noses. It's impossible for you to go into a dry climate without getting a bloody nose, to go on an airplane without getting a bloody nose. You have to constantly put Vaseline in your nose, and any sort of thing that you put in your nose to help with sinus really aggravates your dry nose, and then you get bloody noses. That's Sjogren's. If you suspect, I mean, for me, I can't diagnose you, I should take that back, but that was Sjogren's for me. If you are going to the doctor and they keep saying, man, your eyes are really dry, try these artificial drops and come back, and maybe you start to get clogged. It starts with an M. Oh, wait, chill. Manipular glands. Jill, help me out here. I know you know this. We got a medical professional here. Manipular glands in your eyes. They can get clogged from dry eyes. And sometimes you can even get little stones in your eyes, and you have to have those removed. Same thing with your salivary glands. If you have really bad Sjogren's, it can be a bummer. So, where are you going to go? You're suspecting these things are going on. You've got dry eyes. Maybe it can even be painful with intercourse. You noticed that. Thank you, Kimberly. See, I said it wrong. My Bowman glands. Close? Would I get a pass? I was pretty close. Thank you. Sort of close. I wasn't too crazy off, right? So maybe people are suspecting this is weird. Oh, thank you, Kim. I get a pass. Couldn't spell it. Too funny. Your primary care physician is usually, if you haven't been, oh, thank you. If you haven't been diagnosed with systemic lupus at this point, it's probably your primary physician that you're seeing, and they may go, hey, dry eyes, dry mouth, dry nose. Let's look into this. And if they are doing their due diligence, and maybe you already have joint pain, photosensitivity, a rash, pleurisy, problems with anemia, maybe your blood counts have been off a little bit, maybe you have a little protein in your urine, they should absolutely do their due diligence and do a lupus or rheumatic panel. And at that point, once your primary care does that first preliminary blood work, they should refer you to the experts. And a rheumatologist is really a doctor who will be treating this. Rheumatologists treat rheumatic diseases, but they also treat a plethora of autoimmune connective tissue disorders. And so a rheumatologist is a doctor who will specialize in diagnosing and treating Sjogren's disease, as well as any other overlapping illnesses that pop up, unless it's very specific and out of their milieu, like Hashimoto's or Crohn's. You would go to a gastro, or you would go to an endocrinologist, right? Okay, so, but a rheumatologist treats rheumatic diseases, and rheumatic illnesses are conditions, diseases, disorders that involve pain and inflammation in the tissues of the body. It's not joints. It's not, I know a lot of people think rheumatologists only treat joints. No, it's tissues in the body. And if you're under a care rheumatologist, they will look for certain markers. You'll go probably another step and do a little bit more intensive blood work. and they will look at different things in your blood if they think that you have this lupus overlap condition, Sjogren's disease. They'll look at your rheumatoid factor. They're going to look at your kidney function. They're going to look at your anti-nuclear antibody. And by the way, there's a whole lot of stuff coming out about your ANA and whether to keep testing it or not test it, how high it should be, like what titer really means, to take note or not, doesn't matter if it's speckled, all these things. And if it fluctuates, does that matter? All this stuff. Yeah, it's the whole thing. It's the whole thing. Anyway, they will look at that. They will also look at what they call the Sjogren disease antigen, which are antibodies, and they are SSA and SSB. That's for Sjogren syndrome antibodies, but we don't call it Sjogren syndrome anymore, but they still call it SSA and SSB. All right. They also can call it, if you may have heard this, RO and LA antibodies. Go deep. You're going to look. We've got all these antibodies. There's like over 200 antibodies that lupus patients can have. And whether you have this one or that one can kind of determine what overlap conditions you may be prone to. Are you, if you're positive for SSA, SSB, and RO or LA, that could be Sjogren's. If you have this one and this one, that could be scleroderma. Yeah, I know. Or it could be RA. The RA and lupus antibodies are very similar. The same with the DNA expression, but that's getting into the weeds, and I don't need to go down that rabbit trail. So once they kind of look at your blood work, listen to your complaints, talk about your medical history. Maybe your mother and your grandmother always said they had to have a bottle of water with them at all times because their mouth was always dry. Maybe they had Sjogren's and you got passed down as well. And after that, if you are really dealing with dry eyes, which can impact your vision, can be really uncomfortable, you will go see an ophthalmologist. And an ophthalmologist is a specialized eye doctor that study and treat diseases of the eyes. Ophthalmologist is also the person that you should be seeing twice a year if you are taking the lupus life insurance policy, which is hydroxychloroquine, brand name Plaquenil, because that can, in very small percentages, impact your eyes. So you go and you stay proactive and you make sure that you get your eye and your field of vision study and your scans of your retina and all of that done twice a year. So that's an ophthalmologist that should do that specialized testing. And it's also an ophthalmologist that will keep an eye on your Sjogren's disease. They will be able to look and see how dry your eyes are. They'll be able to tell if you have burning and stinging of the eyes, blurry vision, if you're sensitive to light, if you have inflamed eyelids, if those meibomian glands are clogged. And they also sometimes perform a dry eye test. It's called a Schmermer's test. Am I saying that right too? And this is when, and I've had this stuff where they take a tiny piece of paper and they insert it under the eyelid to measure the amount of tears that are produced over a 5-minute period. I think it's 5 minutes. And they can tell, well, this is really below normal, this is normal, this is above normal, if you have watery eyes. And they can see how quickly your tears dry up. Now, tears are not just water, they're oil. And that's why the meibomian glands produce oil. So it's really important to see how much meibomian, I'm saying it wrong, meibomian, there it is. Anyway, and there are about 25 to 40 meibomian, there we go, glands. Just forget anything I'm saying. The mouth is dry, I can't even talk right, in your eyelid, and upper and lower eyelids. And if those glands get swollen, if they're under attack, if they get blocked, as I mentioned, they don't produce tears. They don't produce tears. So these, they can take pictures really close up of your glands, an ophthalmologist, and they can tell how bad the blockages are, the extent of the dysfunction, and sometimes they can do a little surgery where they open those up and they fix those for you. Yeah. But it really depends on how bad it is. Treatment for Sjogren's disease varies because of the varying of intensity of the symptoms. If your glands are affected, they can do the seal and tear the ducts open. They call it a punctal occlusion to help relieve your dry eyes. But most people manage their dry eyes with artificial teardrops. Also, sometimes there's prescription eye drops. The jury's still out. I'm really interested to know if you have tried Restasis here. Some of these drops are extraordinarily expensive, and you get this teeny tiny little bottle, and then you hear your ophthalmologist say, well, 50% of my patients say it helps. And then I think, that bottle is $85, and you're telling me there's two people, one says it helps and one says it doesn't help. If I was a betting girl, I'm not sure I would take that bet. You know what I mean? So for me, I have not used Restasis because it's expensive and I just stick to my artificial tears. I'm interested though. Have you tried it? And do you find it helpful? I would like to know. Maybe I will revisit that. So yeah, there's also Xiidra, which is another one similar to Restasis. There are other medications you can take to increase saliva for your dry mouth. And sometimes it can help with tear production. Saligen, Evozac is another one. So there's also, if you're having a lot of inflammation, the doctor, rheumatologist may prescribe a non-steroidal anti-inflammatory medication. If you have those antibodies are really present and strong, they may also, but you haven't been diagnosed with lupus, they may also very well put you on hydroxychloroquine, because it is a wonderful drug for most people. It is a very safe drug, and it really works systemically. So if you have anything brewing, it can stop things from spreading and stop things from getting really bad. So hydroxychloroquine, aka Plaquenil, can be helpful with treating systemic Sjogren's syndrome. Also, drugs that suppress the immune system, if it's really bad and you're dealing with Sjogren's, you're also dealing with SLE, you have some RA overlap, they may try something like methotrexate. Yeah, methotrexate, which is it's been along for a very long time. It was originally used as a chemotherapy drug for B-cell cancers such as lymphomas, non-Hodgkin's lymphoma. And then they realized kind of by mistake that the patients who had RA, their joints were feeling better. And so they realized that they could give it in low doses, much lower than we do in the cocktail chemo, to rheumatic patients. And now they realize that a lot of patients who have these overlap conditions benefit from it as well. I have taken methotrexate for many years. I have done the pills, and I've also done injections, and it is by far the best drug for me to help with my joint pain. It actually works better for me than Benlysta. Oh, look at this little love bug. Look at these big ears. They're getting so big. Okay, let me stay on. Sorry, cute puppy distracted me. Let me go back to my notes. So some things to consider, to talk to your doctor about, and even bring up with your doctor. You have every right to go into an appointment and say, I don't think this is being managed well. How do you feel about this? You are the expert in your body. And you don't have to think, well, my doctor hasn't brought up taking that particular eye drop, or my rheumatologist hasn't brought up trying hydroxychloroquine or methotrexate. Am I okay? Should I bring it up? Yes. What's the harm? They might say to you, you know what? Your white cells are a little bit low. So the reason I haven't brought it up is because I'm afraid that the methotrexate may make that worse. Or because of your in your blood, this may be the best course of action for you. At least you will have that conversation. That is called shared decision making. Okay? All right. There are some things, though, that you can do outside of your doctor's office to be proactive if you believe that you have Sjogren's disease. Do not smoke. Smoking is the worst for Sjogren's. It also will completely interact with hydroxychloroquine and cancel out any of the benefits. It is known that it does not do well with that drug, okay? Increase your fluid intake. Make sure you're always drinking water. Caffeine can make it worse, so just be aware. I know it's really hard. I've got my little cup right here. It's really hard, but it can make it worse. Caffeine can also make your Raynaud's worse. For another time, we can talk about that. So you can stimulate your saliva. I know this might be not everyone's thing. Some people find gum chewing really rude, and I want to be respectful of that. But for me, I constantly have to have a mint or gum because my mouth gets so dry. The xylitol in sugar-free gum and sugar-free candy is actually good for your Sjogren's disease. All right. I know some people don't like the fake sugars, but the xylitol, if that's what's in your toothpaste, it's actually really good. There's also artificial saliva. You can buy these lubricants that you put into your mouth. There are sprays, there are lozenges, there are mouthwashes, and then nasal sprays for those of you who are like me, who have really dry nose and who get nosebleeds. Make sure a nasal saline gel. I can't do, and even I find sometimes the saline spray will bother me. It will, and I don't know why. But the gel, the saline gel, is the bomb. Also, if your nose is inflamed, then you end up breathing more through your mouth, and then your mouth will get more dry. So that's not good. So you've got to make sure your nose stays good. Your nose also, too, and I said this the other day to somebody, is a breeding ground of bacteria. Your nose, there's so much going on. I don't even want to talk about it. There's so much going on in your nose, right? Same with your mouth. You have a whole microbiome in your mouth. You've got to take care of your nose and your mouth. You are breathing in bacteria all day friggin' long. So make sure that mouth is tip-top shape, okay? Use those mouthwashes, get that gum, use the things you need to put into your nose. The last thing you want is nose and mouth sores as well, which we're already prone to, okay? So that is good. And then for dry eyes, I mentioned the artificial tears or artificial lubricants. Also, use the humidifier. When I went to Palm Springs, it's really hard for me to go to drier climates. And I was in Palm Springs, and I was like, oh boy. But my in-laws had a humidifier that I borrowed, and it made such a difference. Oh my gosh, I was like, why have I not done this before? I put it right by my face, and I didn't get a bloody nose. I was so happy. That never happens. So a humidifier will really help. It at least helps me, okay? Also, for dry eyes, dry nose, warm compresses on your face. Yes, not ice packs. You need warm, this is what my ophthalmologist told me, warm compresses, not eye packs. I know a lot of times you want icy ice packs on your eyes. You need warm compresses. Put them, and you can massage your eyelids very gently to help with the meibomian glands. Still not in your right. And then you can also breathe in kind of the moist air for your nose as well. Stay away from having fans blowing into your eyes, into your nose, into your mouth. That's really hard this time of year with going in and out of air conditioning and all of that. And then ask your doctor about an omega-3 supplement. Some supplements can interfere with certain medications and can cause bleeding and things like that. So make sure that you check with your doctor before you start any supplements. But omega-3 fatty acid supplements and eating a diet rich in omega-3, I'm talking about fish, avocado oil, avocados, extra virgin olive oil, all those things can really help with Sjogren. That's what I'm told. Okay. Make sure that your dentist is aware that you're dealing with Sjogren's. They can talk to you about how to brush your teeth, how to, to apply topical fluoride to treatments and antimicrobial mouthwashes. There's all sorts of things for that. I really like this mineral toothpaste too, because dry mouth, unfortunately, can increase your risk of dental cavities and tooth loss and gum disease. So this one right here, I hope this will work, is my favorite mineral toothpaste. So the other thing is too, this thing with your skin, you should probably avoid really hot showers because it can dry your skin out even more. So I know it's hard, but you shouldn't be doing really, really hot showers anyway if you have Raynaud's, because that will cause your hands and feet to flare, or at least it does for me anyway. And then there's also moisturizers and lubricants for vaginal dryness as well, which is super important to talk about. We don't talk about that enough, and how that can impact intimacy. And I'm not afraid to go there. So if you want more information on that, let me know, because we did write a whole blog about lupus and intimacy. So there you go. There's unfortunately no known cure for Sjogren's disease. But many of the symptoms can be treated, and with simple corrective measures, seeing the right doctors, getting the right tools in your toolbox. But please check back with us. I'm hoping to do a virtual event the end of the month to talk more about Sjogren's, and with our favorite Dr. Thomas, so more on that. So yeah, that's it. That's a lot of information. And I was going to read from my book, if I can get this puppy to move. Oh, I'm sorry. Are you sore from your shot? I'm sorry, baby. I'm sorry. Okay, hold on. Got my book here. I know. Okay. Hi. I'm back. Where's it? Hold on. I want to give you a little inspiration today, which I usually do. And then we'll move on to our comments. And we have a few comments here. Would really like to. Man, my mouth is so dry. I lost my spot too. I have pulled these things for today. All right. So I'm reading from Daring Greatly, which is by Brene Brown. And Daring Greatly is a term taken from Theodore Roosevelt's speech, part of his speech, not the critic that counts speech. So I'm going to read that because I feel like in a world when you live with chronic illness, everyone's going to have an opinion about what you should and shouldn't be doing, and how you're handling your different parts that you manage. And sometimes people think you are not wearing what I call your sick clothes the right way, and that you are confusing to the world because you decide to go on living. And gosh, shouldn't you just close the curtains when you have a chronic illness and look a certain way and act a certain way and do all those things, right? And so I read this the other day, and I thought, I haven't read this in a while. And here it is. It is not the critic who counts, not the man who points out how the strong man stumbles, or where the doer of deeds could have done them better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again. Because there is no effort without error and shortcoming, but who does actually strive to do the deeds? Who knows great enthusiasms, the great devotions, who spends himself in a worthy cause, who is at the best knows in the end the triumph of high achievement, and who, at the worst, if he fails, at least fails while daring greatly. Daring greatly. And I'm going to challenge you today, what does daring greatly look like for you? Does daring greatly mean simply being honest with somebody about where you're at, emotionally or physically? Does daring greatly mean getting back to something that really brings you joy? Does daring greatly mean having tough conversations? Does daring greatly mean appropriate boundaries? Does daring greatly mean being honest with yourself? That you can't be everything and do everything at all times? Does daring greatly mean allowing space to grieve? Maybe you haven't done that yet. Whatever that is, think about that today, and that is your inspiration for the week. And I'm so happy that I got through this chat with this little pupster on my baby. I know. And let's talk to some people while we have food. So Kimberly is here for the first time, and I'm so happy you made it on. Thank you. By the way, Grace is the name of my other dog. So this is Frankie. So we've got Grace and Frankie based on the wildly popular Netflix series, Two Crazy Gals. Oh, baby, I know. Her shoulders short from her shots. And we have Jill here. Jill is a wonderful, wonderful person that helps us from time to time. Is going to be writing a blog for us and has been a part of our online community. Thank you so much, Jill. We got Naomi here as well. We got East Coasters, West Coasters, and a few Portlanders here. So happy to see you. Hi, Cheryl. Yes, thank you for correcting me. I appreciate that. And thank you for giving me the right words. I appreciate that. Couldn't spell it. You did great. Oh, I'm sorry to hear that you have all of that, Brenda. And Brenda's saying hi to Kimberly. I am on Plaquenil only and my C4 has dropped lower. I'm thinking about Benlysta. Anyone have experience with this drug? That is a fantastic question. I can speak from my own experience. I have been on Benlysta for almost 7 years, I think. And I've done both the auto-injector. I started with the auto-injector and then I switched to infusions because I found the infusions to be kind of convenient to just go in and do them once a month instead of having to inject once a week. And then during cold and flu season, I decided to switch back to injections. So if I got sick, which I've gotten sick quite a few times with my young child, who brings home different bugs and viruses, but I'd still be able to get a little bit in me, even if I had been sick one of the weeks of the month. Whereas with the infusions, if you miss your window, you miss it, and then you won't get anything for the whole month, right? And it can be hard to reschedule. So Benlysta was the first FDA-approved medication studied specifically for the treatment of lupus. Did you know that? Yeah. Until that time, we had 3 other ones, aspirin, corticosteroids, and hydroxychloroquine. Now, all of those are what we call off-label medications, which means that they are approved by the FDA, but they were originally approved to treat something else, right? Aspirin was approved to treat cardiovascular disease and inflammatory issues. And then we had corticosteroids that were used to be used for all sorts of other medications. And then hydroxychloroquine is an antimalarial that they found out could help with immune regulation. And it wasn't until the 1950s that hydroxychloroquine and corticosteroids were used together. And actually, some scientists and doctors won the Nobel Prize because until such time, if you were diagnosed with systemic lupus, you were given 2 years to live. Then after that, people were living much longer, much longer. So it was a big deal. So that was all we had. And then about 15 years ago, they came out with, and it's through GSK, Benlysta. And Benlysta is a monoclonal antibody that is given as a once-a-month injection. It's about a 2-hour ordeal. So, once you get used to it, it can be shortened a little bit, but, or a weekly auto-injector pen. You don't have to push the needle into you. You press a button and it does it for you. And that's a once-a-week deal. And they have shown, they've got a lot of great long-term data, that the side effects are generally low, but the benefits have been great. A lot of people have found that not only does it help with systemic lupus, but now it was approved a few years back for lupus nephritis, which has been incredibly helpful. It goes after those overactive B cells that we have in our immune system. So I found it to be pretty helpful. Does it take away every lupus symptom you have? I don't know exactly where and how your lupus is affecting you, but I found it helped with my brain fog. It helped with my mouth and nose sores. It helped a little bit with my fatigue. It didn't quite, because I have a lot of rheumatoid arthritis overlap, I didn't really get my joint pain all the way. So I did have to stay on methotrexate. If you have any more questions, we have a full blog on morethanlupus.com about Benlysta, so check it out. Oh, I lost my place. Okay, here we go. Oh no, lost track of time. Hi, Derek. Good to see you here. Love having you here. And then thank you so much. I'm struggling with fatigue and joint pain. Yeah, so Benlysta is a great, I think, stepping stone. And I think that, when you hear infusion, you think, oh, that's a little scary, or you think, oh, I'm gonna have to inject myself with something. It's simply because it's so new that this is the way we have to administer it. But honestly, it is the most studied lupus drug that we have. And I gather that Dr. Thomas would reiterate my thoughts and say it's one of the safest. If you were to look at steroids versus Benlysta, I guarantee 9 out of 10 rheumatologists would say try Benlysta. Steroids are great to get that inflammation down quick, but nobody wants you on steroids long term. It can be really, really hard on your body in many other ways. So finding these other avenues to treat systemic lupus is the goal. Yeah. So, well, everyone, it's been a pleasure today. I'm already 4 minutes past the hour. I'm going to let you go. Thank you to all the new people who joined today. Don't forget to continue to share this chat so other people can get connected to support. Check out the YouTube lives that are up on our More Than Lupus YouTube page with Dr. Thomas. We've got more your way, more coming your way, as well as information on Minority Health Month. Take care, and I'm so happy I was able to be back with you today, and I will see you all soon. Bye for now.